So what does a shift in attitudes towards private healthcare mean for Scotland's NHS and for the principle of healthcare free at the point of need? Let's put that to our panel. Joining us is the GP Dr Becky Howie, who works in both the NHS and the private sector, the former Health Secretary Alex Neil, and the health journalist Penny Taylor. We were all marvelling at that surgery there, weren't we? Just amazing stuff. Becky, you work in the private sector. What kind of patients are you seeing?
Very much ordinary, everyday people, you know, that just have got to a stage where either they want to move things along quicker, or that they want more time, or that there are certain services that are no longer available within the NHS and they feel that that would be suiting them better. So it's very much not your super rich, it's not your, and often not in health insurance either, it's just people paying out of their own pocket.
People like Maureen, who's delayed her retirement to get that surgery. Yeah. Penny, this growing demand for private healthcare, is it going to become more and more normalised?
Well, I think if there is no improvement in the waiting times to access NHS services, then very possibly, and there's certainly fears out there, that this heralds the end of a universal NHS. Since 1948, we've had a health service that has said it can be for everyone. And, you know, I hear of families that club together to raise the money. I mean, it costs £15,000 or something for a joint replacement. You know, not every family in Scotland can pull that kind of money together, and the fear is then that if it carries on like that, you have a two-tier American-style system.
Well, I mean, Alex, does this point to the fact that the NHS is in crisis? How much of what we're seeing now, this rising demand for private healthcare, how much is this down to the political choices and decisions that have been made over the last decade or so?
Well, I think what we're seeing now is the fundamental principle on which the NHS was based, which is free treatment at the point of need, is being eroded and undermined. If you look at particularly Maureen's case, she's not voluntarily going to the private sector. She's going because she feels she's been pushed into going to the private sector because she's in so much pain and she can't wait another 4 years to have the necessary operation. So she's spending some of her life savings, maybe all of her life savings, in getting an operation that she should be able to get easily and timorously in the National Health Service. So I think this is a crisis. It's a crisis that is fundamentally undermining the founding principles of the National Health Service. And we should all be extremely worried about that, because it's not getting any better. The situation is getting worse by the day.
How has it been allowed to get to this stage? I mean, think back to the time when you were Health Secretary. Did we not see this coming down the line, that things were increasingly becoming more difficult?
We were never anywhere near this kind of crisis that's developed in the last 10 years or so. And I think it's this, that there's been lots of money allocated to the National Health Service. In Scotland this year, the budget for health and social care is £22 billion. It's a lot of money. But we haven't reformed the health service. We haven't made the changes that are necessary from top to bottom to make much more effective use of that money. And I think we've got to do that in the future. Otherwise, we're going to have many more Maureens having to go into the private health sector.
I mean, the Scottish Government insists that only 1.8% of the population used private inpatient or daycare last year, and points to record investment in the NHS. Penny, record investment.
Yeah, absolutely record investment, and you know, huge increase in the number of consultants in hospitals, but for some reason the productivity of the system is going backwards. Why that is happening is the subject of a great deal of discussion, but as somebody put it to me recently, what we have is a system that was designed for 1948 and just hasn't kept up with development.
Society's changed completely,
yeah.
and
expectations have changed.
Yeah, people go on and buy something from Amazon, expect it the next morning. Now, we should allow people to expect a hip surgery quickly, but the whole mindset of people is completely shifted.
Yeah, but why can't we access health advice 24/7?
Yeah. But just coming back to the whole kind of the principle of private healthcare, does it have an adverse effect on the NHS? Because there's a limited amount of staff to go around.
Yeah, I mean, that's a problem, isn't it, that people move away from doing NHS practice. But I think when you've done it for 20 years, and for me personally, I got to a stage where I didn't feel like I could do it the way I was trained to do it anymore. You feel that your options are severely limited. There's so much bureaucracy, red tape. You know, if you do have ideas for change, it's so difficult to push anything through. And we were talking about that earlier, weren't we? It needs a complete rethink.
And the other thing is the National Health Service itself is one of the biggest users of the private sector now, because they're using the private sector to try to get their waiting list down. And the cost per patient in the private sector is a lot higher than the cost per patient in the National Health Service. So that means you're draining money out of the system and making less use of the money you've got. So on the whole, there are benefits to having to use that capacity. It's a good job it's there, because the waiting list would be a lot worse if that capacity wasn't there, but it's by no means the ideal or the intended position that we were supposed to be in. The National Health Service, if properly organised and properly managed, should be able to cope with the level of demand we have.
But you think it's eroding the National Health Service, don't you?
Absolutely. I think there's a limited number of doctors, and if more are working in the private sector, there are going to be fewer. In the public sector, it's perfectly obvious, isn't it? And, you know, it is no coincidence that big business now is interested in, you know, what the money it can make out of healthcare in Scotland. You know, for instance, there are, I'm told that there are big conglomerates taking over general practice that are even backed by hedge funds. Now, they're only in it for the money.
But then health has always been about the money. Drug companies, nobody's producing these drugs. Look at what's happened to Mounjaro prices recently. Nobody's sitting there saying, oh, we've made this brilliant product, it's going to change lives, let's put it out there for free, you know.
No, but nobody's suggesting that's what should happen.
There's also a lot of waste in the system. I remember as the Health Secretary, I actually asked for a comparison between what we paid as a National Health Service for paracetamol and what you would get it for if you walked into Boots yourself. We were paying well over the odds. So there's a lot of wastage in the system. We are running aground with managers, but nobody seems to be properly managing the resource.
What needs to change within the NHS then to get the waiting list down so there isn't such a demand for private healthcare then, which not everyone can afford?
I mean, the problem isn't what happens within the NHS. Once you get into the NHS, you get fantastic treatment. And let's face it, none of these private hospitals have an A&E department if something goes wrong while you're on the operating table, okay? So there's a whole overhead there that the NHS has to carry. But, you know, social care. If there are fewer people ending up in hospital who can't get home, then you would get the patients through. You would have the beds to take people. At the moment, if an emergency comes in, an elective case is dropped, there's an argument for having what they used to call hot and cold hospitals where elective work happens, planned work, and emergencies, and they're separate.
All seems to come back to that, doesn't it, Alice?
I mean, let me give you an example, because this is not, you know, you don't need a Philadelphia lawyer to work out what needs to be done. It's just not been done. There are three big problems in the health service. Three of the biggest problems are delayed discharges, A&E problems, and then ambulances. It's a patient flow thing. So if we stuck to the original plan that was there 11 years ago to build what were called intermediate units, and they would take people who are medically discharged but cannot go home because the care package isn't in place. So they're medically discharged, they should be immediately then removed from an acute bed and put in an intermediate unit.
Like a cottage hospital.
So that frees up 15% of the beds. That would go a long way to solving the problem at A&E. Solve the problem at A&E, that goes a long way to solving the problem with the ambulances having to sit outside waiting to get paid for hours for patients to get in.
It's all still acute medicine. medicine. It's not
Exactly.
looking at prevention.
No,
and
that's
there's a
right.
huge
That's
part of
part of it as
prevention.
well.
Yeah.
Becky, do you see private healthcare and the NHS working together collaboratively?
I would
Do you
love
think there's a
that.
place for
I
both?
think there's digitalising things so that people can carry their own patient records, so that people can go between NHS and private, that it's seamless, that they work collaboratively rather than them and us, that it's much more of a system that works together. I think that would help patient flow, patient journey, and there is a potential, if it worked smoothly like that, it could offload some of the pressure on the NHS. But I agree, if we could get it sorted, how it was when I trained, even 20 years ago, would be wonderful.
You wouldn't need
to
to
get
use
that,
the
we need
private
to do
sector.
2 things within the National Health Service itself. Number 1 is decentralise it and de-layer the management structures. And if it's much more local, then there's better chances of cooperating with GPs, social care and all the rest of it.
Okay.
And
Well, we will have to leave it there. I'm sorry, if we had another 12 hours, we could have sorted the whole problem, couldn't we, between us? Well done, all of you. Thank you so much for joining us.